I'm Deborah Hoover, possibly better known as Pepper Hoover. My now husband of 49 years in high school, my maiden name is Salter, so he kind of nicknamed me Pepper Salter, and so it stuck. My best friend, next door neighbor, her mother was a nurse, and so I became immediately interested and started taking care of my dolls and dogs, and then I volunteered as a teenager at St. Margaret's Hospital in Montgomery as a yellow bird. I even had a yellow pinafore. I got to visit with patients and learn how to communicate and just actually assist and take people magazines and interact with the nurses. But that was very influential to me, that I got a taste of what the healthcare system was like. That was not a hard decision for me. I started at my college career at the University of Alabama here in Tuscaloosa, and they did not have a nursing school at that time, so I transferred to the University of Alabama at Birmingham and completed my BSN and my MSN from UAB School of Nursing. I did clinicals in the cardiovascular intensive care unit at UAB, and they had a very technologically advanced unit. It was driven by computers, and in the 70s, the computer, I think, was the size of a large room. But when I went with that nurse into the cardiac unit, that was it. I was hooked immediately on cardiac and opened my eyes to my first passion, which was cardiac nursing. UAB offered one of only 3 cardiovascular clinical specialist programs in the country. So I had to figure out how to fit that in because there were no online courses at the time. So a friend suggested that I might be good at teaching. Well, I'd never really considered teaching, at that point. But I always, I think, thought of myself in the hospital at the bedside. But I applied for a job at St. Vincent's Diploma School of Nursing, and Mary Catherine King hired me when I was very young, but there were no critical care courses, and they were starting a critical care course. And because of my background in CICU, she hired me to initiate that course and paired me with a seasoned educator, and it was that opened my eyes to my next passion, which was seeing the light bulbs come on in students. So that started my next journey, which was nursing education. I was recruited to help with a clinical group at Wallace State. I did not know anything at the time about a community college. But my clinical group convinced me that I needed to really concentrate on coming back to education. I accepted a position in 1990 and decided I would take it 1 year at a time. And it did not take me long to embrace that mission of helping people who always had a heart for healthcare, who might not have had the academic advantages and maybe the economic advantages that other people had to be able to go to a college of their choice. As they say, the rest is history. I've been at Wallace State ever since. It's not one person, and I'm certainly not responsible for all of Wallace State. I work with a fabulous team. I would hope the impact that I've had is through a lot of our graduates who are now, some of them are on faculty with me, and some of them have gone on to advanced degrees. If I have empowered someone to actually earn a living so they can support their families and add to the next generation, I hope there's some people taking care of patients that remember and possibly they knew I had a little bit of a passion for cardiac nursing. And I hope that maybe that's a legacy that I've given or left behind for some people for the future.